Good day, everyone. Welcome to our group presentation on elephanitis or lymphatic filariasis, right? Today, our group members include Devanand Ramkissoon, Joseph Chalet, Karina Seemungal, myself, Karisma Ramjattan, and Michelle Hall. Our objective will include to look at the causes and histories of elephanitis, four symptoms associated with elephanitis, and two interventions being pharmacological and surgical. So firstly, what is elephanitis? Elephanitis, also known as lymphatic filariasis, is a painful and disfiguring condition. It affects people of all ages in places where it is spread. While the illness can be contracted as a kid, obvious signs such as limb-swelling edema might arise later in life, resulting in temporary or permanent impairment. Lymphatic filariasis has a significant social and economic impact in endemic countries. Lymphatic filariasis impacts more than 120 million people in 72 countries in continents such as Asia and Africa and the Western Pacific and parts of the Caribbean and South America. Now we go into the history of lymphatic filariasis. So the oldest evidence of lymphatic filariasis comes from Egypt with a statue of a pharaoh shown to have swollen limbs with the characteristics of the disease, while artifacts from West Africa around 500 AD also showed swollen testicles. The oldest written record of elephanitis comes from the Air Papyrus in 15,050 BC in Egypt. In later times, Greek and Roman writers began to refer to leprosy as elephantitis grucum and lymphatic filariasis as elephantitis avium. Now I'll pass you over to my colleague Michelle to do causes of elephantitis.
What causes lymphatic filariasis? This is caused by parasites known as nematodes or roundworms, which belong to the family of Filaridae. These are spread through the bites of the infected mosquitoes. Mosquito-transmitted larvae are deposited on the skin and can enter the body from there. The larvae subsequently travel to the lymphatic arteries, where they mature into adult worms, thus completing the transmission cycle. These thread-like filarial worms come in different variants. These variants are Wuchereria bancrofti, which is responsible for 90% of the cases, Bergeria malari, which is also responsible for the remainder of cases, and last but not least, Bergeria timori, which also assists in causing disease. Adult worms that nest in lymphatic channels interfere with the lymphatic system of operation. These worms create millions of immature microfilariae which circulate the blood over the course of approximately 6 to 8 years. When the mosquito bites an infected host, it consumes the blood and becomes infected with microfilariae. In the mosquito, microfilariae develop into infectious larvae. With that being said, mature parasite larvae are dropped onto the skin by infected mosquitoes where they can enter the host. After migrating to the lymphatic veins, the larvae grow into adult worms, completing the transmission cycle. Different mosquito species, such as the Culex mosquito, which is common in urban and semi-urban regions, and the Anthopheles mosquito, which is primarily found in rural areas, as well as the Aedes mosquito, which is primarily found in endemic islands in the Pacific, all transmit lymphatic filariasis. I'll now pass you over to Devanand.
Symptoms of elephantitis. This infection involves asymptomatic acute and chronic conditions. A majority of infections are asymptomatic, showing no external signs of infection while contributing to transmission of the parasite. Asymptomatic infection can still cause damage to the lymphatic system, kidneys, and alter the body's immune system. When the infection develops into chronic condition, it leads to lymphedema or elephantitis of the limbs, scrotum, breast, and genital organs, acute episodes of local inflammation involving skin, nodes, and lymphatic vessels typically accompany elephantitis. Some of these are caused by the body's immune response to the parasite. This is mostly the result of secondary bacterial skin infection, where normally defense defense have been partially lost because of underlying lymphatic damage. The most common symptoms of elephantitis is swelling of body parts because of the accumulation of fluid. Swelling mostly occurs in the legs, genitals, breasts, and arms. The skin around the area may become dry, thick, unsalted, darker than normal, and pitted. People are also at risk for a secondary infection because of the immune system being affected. Some people may also experience fevers, chills, and general pain in the infected or swollen area. Now I'd like to pass you on to Joseph.
Elephantitis interventions. Pharmacological interventions. Those infected with the adult worm can take an annual dose of diethylcarbamazine or DEC. This drug kills the microscopic worms circulating in the blood. This drug may not kill all the worms, but it does stop the spread of the disease. Adults and children older than 18 months who have lymphatic filariasis can be treated with the DEC therapy, lasting anywhere between 1 to 12 days. The recommended dose of DEC is 6 milligrams per kilograms per day. Longer DEC treatment are advised for the treatment of tropical pulmonary eosinophilia, the duration being 14 to 21 days. The quantity of microphilia in blood affects the severity of occasional side effects. The most frequent adverse reactions include nausea, fever, headaches, and pain in the muscles or joints. Surgical interventions. Advanced lymphatic filariasis (LF) is a clinically difficult impairment that lowers quality of life. Medical care of advanced lymphatic filariasis is rarely successful, and few surgical options are helpful. But the surgical approach for patients with advanced LF was carried out in 3 successive humanitarian missions to India between 2014 and 2018 that combined serial excisions with vascularized lymph node transfer, VLNT for short. A total of 17 patients with grades 2 and 3 lower limb lymphedema underwent excision of extra soft tissue in the leg and a supraclavicular lymph node transferred to the dorsum of the foot. Microanatomosis, which is a surgical procedure that is used to connect vessels to each other, was carried out after recipient vessels were prepped. Lymphedema, which is swelling due to buildup of lymph fluid in the body, was measured using various leg circumferences measurements. Infectious lymphangitis episodes, which is inflammation of lymphatic channels due to infections or non-infectious causes, and lymphoscintigraphy, which is used to identify the central lymph node or the first node to receive the lymph drainage from tumors. Results. The result was a significant decrease of lower lymph circumference measurements at all levels was noted. Post-operative operative lymphoscintigraphy revealed reduced lymph status. One patient suffered with a seroma on the donor site. 6 patients had partial loss of skin graft over the flap at recipient site, and it was managed by regrafting data analysis. Observed statistically significant reduction in feeling of heaviness and episodes of acute lymphangitis after surgery.
Elephantitis is a painful and disfiguring condition that affects people of all ages. This is caused by an infection of parasites classified as nematodes, which are transmitted through the bite of an infected mosquito. Elephantitis influences over 120 million persons in Africa, Asia, and the Western Pacific, parts of the Caribbean, and South America. The infection involves asymptomatic, acute, and chronic conditions. The majority of infections show no external sign of infection, while contributing to transmission of the parasite. A standard method for diagnosing active infection is the examination of the blood under a microscope to identify microflarion found in the blood. A few ways one can prevent becoming infected are by sleeping under a mosquito net, wearing a long sleeve and trousers, and by using mosquito repellents on exposing skin between dusk and dawn. With that being said, elephantitis can be eliminated by stopping the spread of the infection through preventative chemotherapy with safe medications combination repeated annually. This is a list of our references that we use on this project, and we thank you for your attention and hope you guys had a wonderful time listening to our presentation. Thank you very much.